Well, thank you very much. So, sorry, but we'll have to switch to the English language for a bit now. My ability to speak Greek is very, very, very limited. So what I will talk to you about today, so we heard about the impact of cancer, how important it is as a disease. We heard about innovation. What I will talk today about is sharing our experience with what we do in Canada in deciding how much funding we allocate to cancer and how much funding we allocate to specific parts of cancer. So what I'll talk about is not research work, it's real life experience work, real work in Canada that we do with healthcare organizations. It's not the way that all healthcare organizations make decisions, it's the way some of them do, those that I work with in the country do that, but it is something that's becoming more and more popular each year. So I've got 20 minutes to do this. I'll take about half the time to talk about the methodology, and the second half I'll just show you a real-life example of the work we do and how it leads to decisions on funding for cancer care. So when we talk about a framework to make decisions on resource allocation, decisions on how you use the resources you have, how you use the funding you have. In my mind, there are two components that are essential. The first one is to have the right economic principles. Pretty obvious. But the second one is an ethical component to the process. And the reason for this is that irrespective of whether or not you have the right economic principles in your process, irrespective of how well you implement your process, there will always remain an element of uncertainty in healthcare. There is no way that we can say, if you follow this process, we can guarantee to you 100% that you will get the right response, you will get the right resource allocation mix. There's always uncertainty, and in that context, it's essential for the stakeholders, the people who care about the process, about the outcome. It's essential that we have a process that is perceived as fair. It's essential that we have a process that people can trust will lead to the best possible answer with the information available. Without that, we have a process that will be probably lead to improvement over what can be done without a process, but the trust will be lacking, and that will undermine the process. So the economic principles that are essential in my mind to a framework that is a proper framework to make decisions on resource allocation is based around two principles. The first one, opportunity cost. Opportunity cost is a pretty simple concept. If you put resources, for example, in cancer care, you can't use these resources somewhere else, therefore you forego some benefits from the other alternative use of the resources. Very simple concept. What it means in real life is you really cannot make a decision on funding, for example, some activities or interventions in cancer care strictly on the basis of your assessment of those benefits. Everything is relative. You have to compare to what you could get for those resources in a different setting. The decision is absolutely relative. The second concept is the margin, the marginal analysis. Decisions about resource allocations essentially are decisions about change. Do we provide more funding for cancer care? In what form does it come? It's decisions about change. And decision about change, to be properly done, have to look at the impact of the change, not at the impact of the entire program, not at the impact of cancer care as a whole or any parts of it, but at the impact of any change you may want to make to cancer care. So opportunity cost and marginal analysis. So the ethical part now. Before we get to the process, what we use is the accountability for reasonableness principles from Daniels and Sabin. So five basic points. Relevance. The decisions are based on reasons fair-minded people can agree are relevant. So me telling you that this is very important and you got to trust me would not qualify, for example, as a relevant reason. We want publicity. We want to make sure that everybody who's a stakeholder has access to the thinking behind the process and the outcomes of the process. We have an opportunity, revision, an opportunity for appeals if there's a feeling that some errors were made. We want to respect empowerment, so that we want to minimize power differences throughout the process. And we want to make sure we have enforcement. So we have some rules around the process. We want to make sure that those rules are followed and that every decision around resource allocation goes through the process. If there is an opportunity to bypass the process and get some funding changes without going through the process, again, it undermines the process, it undermines the trust in the process, it undermines the fairness in terms of perception for the process, and the entire validity of the outcomes becomes in question. So the process we use, and these are the 8 steps, essentially it's based on a process that's been around for decades called Program Budgeting and Marginal Analysis, or PBMA. Essentially, I would call it our own version, our customized version of PBMA that we've developed over the last 12 years. And really our emphasis in making changes to this process that's been around for a long time has been to make it very pragmatic, make it so that organizations can use it in a manner that's very efficient in terms of the time it requires and how it leads to the proper decisions. So I'll go through the 8 steps of the process, and I don't have a guide of time on the other speakers. A little clock on the corner will be helpful maybe. So I'll go through the 8 steps, and then we can talk about what it does as a process, and then get to the real life example. So the first step is to define the aim and scope of the process. By aim and scope, I mean what it is that we want to do out of this process. Do we want to, as an outcome, have a reduction in overall spending by the organization? That would be the case, for example, when there's a deficit situation. Do we want to reassess the current spending? Do we have new funding to allocate? We want to be very clear at the outset the reason, the objective of the process, and the scope is the parts of the organization included in the process. We always have typically to exclude some parts of any organization because there's, for some reason, it could be a contract, it could be a law, it could be a directive from the government. There are some activities, some interventions that the organization cannot change unilaterally. What we want to avoid is going through the entire process and finding out after the process has been done that some of the activities, some of the interventions, some of the options selected for implementation cannot be implemented for whatever reason. So at the outset, we want to make sure what's in scope and what the aim is. On the basis of that and linked to that, we form an advisory panel. So essentially, we want every part of the organization that is in scope to be represented on the panel. And not so much for the purpose of advocating or defending their part of the organization, but really to bring in some expertise, some knowledge and experience about their part of the organization and how it contributes to the overall goals of the organization as a whole. So once we have the panel set, which really means that this is a participatory, it's a group exercise, this process, and we have the aim and scope clear, we want to make sure we have a good handle on the finances. We want to make sure we understand where the money is spent, where the funding goes. And that really has to do with shared costs, typically. Sometimes we have a good estimate of what relates to each of the programs, but sometimes not so good. And we need that because we want to know what we get for what resources we use in every one of the programs. Once we've got that, then we really move to the heart of the process. Oops, sorry. The heart of the process, which is developing the criteria. The criteria obviously will determine the outcome of the process and are very critical to the process. What the criteria are really is an operationalization of the objectives, the goals, the mission of the organization. It's really the values of the organization. And that's what makes this process very much a value-driven process. So the decisions made on resource allocation do not come straight from scientific evidence, from data. It comes first of all from an elaboration of the values that the organization cares about. And the information, the scientific information, the data, for example, the cost effectiveness of a given drug or the cost effectiveness of an intervention enters the process through the lens of the criteria, which are again the values of the organization. What is a criteria in the end? When I work with an organization, the guideline I suggest is anything that really matters when you make a decision on resource allocation right now should become a criteria. So for example, to be extreme, if you care about what the media will think about your decision to provide more funding for a certain drug, for example, if it's something that matters to you when you make a decision, then it's got to be a criteria. Everything that matters is a criteria because it reflects on what you care about as an organization, what matters to the organization in terms of making choices. Once we have the criteria established for an organization, and as soon as I'm done with the description of the methodology, I'll show you a real case so we'll see some real criteria and what it looks like. Once we have the criteria decided upon, and by that I mean the list of the criteria, each of them with a well-defined and with a weight. We move to the identification of options for change. Now that relates to the aim and scope of the organization, obviously. These are options, and the word option is very important, for changes, either changes that will cost more money, involve new spending, or changes that will save some money. So what we do there is we ask every part of the organization, we ask a very simple question. If you add, for the period under consideration, it could be the next year, next 6 months, next 4 months, if you add X dollars, X euros less to spend next period, more to spend next period, and that's related to the aim, of course, in terms of the amount in question here. If you had that much more or less to spend, what actions would we take? If you had more money, what would you do with this money? If you had less money, what action would you take to bring your spending to that level? So those are the options for change. We then assess those options using the criteria to find out if it's a spending option, which ones affect positively the most what matters to the organization, and if it's a saving, what affects the least, because you want to create the least possible damage. If you can find a way to reduce spending that would have no impact on everything that you care about as an organization, you have a place to save money. If you have a spending option and you find that it hardly affects at all any of the criteria, which are any of the factors that you care about, you've got a spending initiative that you should probably forget about. Once we have the options rated and assessed, we make recommendations on which ones we are recommended for implementation. So if you have a deficit to bridge, you go down the list until you bridge a deficit. You might look then at reallocation across to some new spending. What that means, and I'll show you the example in a second, is that in the context of a decreasing budget, you can have new interventions, new funding for new programs. We have once recommendations are made, people who are affected by the recommendations are notified. There's a review process, that's the appeal part. If people figure there's a mistake was made, the decisions are then finalized after discussion by the executive team. And then we just look at what happened, especially in the first few process, to evaluate and improve. We look at the criteria. Did some criteria work well? Did some not work so well? Was there some misunderstanding about some criteria? Were some criteria redundant? Was there some misunderstanding about the process? Was there not enough time or too much? We tweak a bit and then we adjust, and then we start again for the next period. So that's the process. It takes to do the entire process anywhere from, depending on the organization, 6 weeks to 2 months. So you start today, of course Christmas would delay, but within 2 months, essentially you have a plan that comes out of the process to deal with your aim. So if you have a deficit to cover, you'll come up with a plan to address your deficit. So, next slide. Oops. Okay, so in terms of outcomes of the process, what we have out of this process is resources that are better aligned with the priorities of the organization. What that means is, in terms of scientific data or knowledge, how it is implemented in any given setting varies with the organization, which totally makes sense to me. Essentially what we're talking about is contextualizing scientific data to the values of an organization and the current status of an organization. We have transparency and rigor in the decision-making process, which leads to greater accountability, certainly makes it easier to explain the decisions made, and then typically we have improved ownership of the decision-making to all the stakeholders. So the example I'll use is a health authority in one province in Canada, Eastern Health. So this is essentially describes, very generic terms, what Eastern Health does. The goal is to provide the highest quality service possible to the people in our communities, our region, our province. It's the largest integrated health authority in Newfoundland and Labrador, provides the full continuum of health and community service, public health, long-term care, community service, and hospital care. Only 3 minutes?
3 more minutes.
Yeah. Okay. I chose, maybe I'll take 5. So I chose Eastern Health because Eastern Health is a province that is in a province that really relies on oil revenue, which really is dropping. So their budget is really under very much stress. And so they're facing actually a reduction in budget next year. So now how do I get to that website here? Let's see. So this should take me to the website that we use to manage the process. Okay, perfect. So I'll log in quickly, an idea of what's going on in real life. This is a Greek keyboard. The where do you get the? Okay. So it's FDIONNE.
Those are the.
This is
Latin characters.
like this? No. How? Like the at? Like
The F?
no, the at.
At.
Oh, okay.
Okay. There's a caps lock.
No, it's okay. Okay, yeah, Dεκemvriu. Okay, so we'll have to go very quickly. So that's Eastern Health. So this is dollars. Canadian dollars is about 1.4 euros. So right now, disinvestments is savings options. Now we have $41 million, about 34 million euros in savings options. There's still $28 million or maybe 20 million euros in development right now. So we'll end up with 60 to 70 million dollars in saving options. We have something like $33 million in investment or new spending options. So to give you an idea, let's see. So on the left, these are all the areas where Eastern spends money. So you have, for example, if you go down a little bit more, so surgery, for example, children's, women's health, long-term care, emergency, 340 cancer care program. So that's one of the programs, one of the areas. So Eastern Health, from the government of the province, about $1.5 billion a year. So about 1.1 billion euros a year to allocate amongst all those services. So Eastern Health decides how much of that goes to cancer care, how much goes to surgery, long-term care, public health, makes that decision. So there's a lot more to say, but all I'll show is right now, for example, in cancer care, we have some proposals. One of them is new oncology drugs, rated score 164. For 3 million, about 500,000. So one of the spending initiatives that is rated very highly for about 2.34 million euros is for new oncology drugs with a high rating. Another one that's very highly rated is the some more money for physicist staffing. These are the people who do the radiation. So I'll show you quickly now. Last thing I show. So this here, this is the proposal for the oncology drugs, and these are the criteria and the scores. So the criteria, what this organization cares about, quality indicators, client experience, home first philosophy, staying at home, for example, access, continuity. So on the basis of all those criteria, the score is 164, which is pretty high. So what that means is that next year at Eastern Health, the budget is going to be reduced to about 20 million euros. In that context, it's very likely they will add some funding to oncology drugs and radiation therapy in the context of a reduction in total funding of about 20 million euros because of the process. Some of the money will come from other activities in cancer care, some will come from other parts of the organization. So that's about the time I had. So this is one, what I wanted to share with you is one way, one example of how in Canada we deal with allocating resources in an environment of very much fiscal and stress. Thank you.